Dr. Pomper, you were telling me that you are hearing that some Mohs surgeons are switching to radiation therapy. Can you expound on that?
Well, it's actually very interesting, and when you think about it, it's very logical, something I would have thought about possibly happening, but I hadn't. So what happened was I was speaking with one of the technicians for one of our radiation machines, and she was saying that in Texas she knows a Mohs surgeon, and he's saying that a lot of the patients, they don't want Mohs surgery right now. They are really scared of having anything invasive, and they know that that increases the risks for problems. Obviously, most people with cancers are older patients and they're already at risk because of other medical problems and because of their age. And they really don't want to wait around in one place for hours and hours. They'd rather go for quick visits to get their radiation and get it over with and not have anything invasive. And the Mohs surgeon is sending a lot of those patients who are coming to him for radiation because they really are, they're very worried, and rightly so.
Why would anybody have invasive surgery if they can do high dose radiation therapy and not go through all that?
That's a great question. You know, the way I look at it is really who's in control of patients with skin cancer. It's dermatologists. And dermatologists, by their very nature, they think about cutting things out because they're basically surgeons, at least when it comes to cancers. And most surgeons are really just dermatologists who've specialized in skin cancers. So, of course, they think about taking care of things the way they've been trained to do it and with what they understand best, and that's cutting things out. So Mohs surgery is really just an extension of what they do if they think it's a little bit beyond them, but it's all within their specialty. And for them to understand and think about radiation is an extra step beyond their basic area of expertise, even though there are some dermatologists who are doing radiation, and I think that they're basically pretty good. They still have not been trained specifically in radiation oncology.
Anytime you can avoid an invasive procedure, that would be the best route, not?
I would think so. I mean, it seems to me it's very clear that anytime you've had any invasive surgeries or procedures, you are at some increased risk with this virus.